If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of 3. Join me each week as we dive into all things pregnancy care, childbirth and postnatal recovery, helping you have a wonderful pregnancy and afterbirth experience. And don't forget to hit subscribe so you don't miss any episodes. Well, hello there. It's great to have you here for another episode of the Fitness Mama podcast. In this episode today, we are discussing the 6-week check after having a baby. This is a brilliant episode with Dr. Miranda Bradley, who is a mum of 3 and general practitioner working exclusively in perinatal health. Dr. Bradley is the founder of Thrive Perinatal, a unique GP medical service providing care to future, expectant and new mums and babies in Melbourne. Thrive Perinatal is Miranda's vision to provide a different and more comprehensive perinatal GP service, a one-stop shop where she can provide more time with future and new mums to help with women's physical and mental health, assist with fertility or pregnancy concerns, baby health concerns, breastfeeding, parenting skills, or any other perinatal issues. In this episode today, we discuss what a 6-week check is and what it involves. Dr. Miranda Bradley also discusses why is the 6-week check so important for mums and partner as well as your new baby. Dr. Miranda Bradley talks us through a few of the things that she comprehensively checks over with both mums and bubs, including discussion about breastfeeding, baby growth and development, contraception options, vaccination options, hip dysplasia, mental health, and more. So if you are pregnant or you're about to have a 6-week postnatal check, this episode is for you. Before I do dive in, I do just want to let you know, coming up very soon, if you are listening to this in the few days after it has been released, there is a live 3-day postnatal workshop which is on again. It hasn't been held for 6 months, but kicking off Monday, 2nd of May, come and join us. It's fun, it's interactive, and it will leave you feeling more confident and empowered about the steps to take to help you get back into fitness post-birth. In these 3 days, we will cover pelvic floor readiness. So how to know if your pelvic floor and core is ready, body strength, stability, and we're going to talk about a step-by-step plan to help you know exactly the next steps you need to move forwards in your postnatal recovery. It's free, it's live, and I am here to support you during these 3 days. So head to fitnessmama.com/free for the link, and the link is also in the show notes. And if you're listening to this in a few months from now, still go and check out the link because there will be a wait list which you can pop your name on so that you find out when it is next on. Right, let's dive into this episode. So Miranda, thank you so much for joining me today on the Fitness Mama podcast. It's great to talk to you all about the 6-week checkup. So thank you.
Thank you for having me. It's a pleasure to be here chatting to you today.
Oh, fantastic. So could you just give the listeners a quick little introduction, who you are, why you do what you do, like what made you start Thrive Perinatal? Would love to know.
Right. Well, I'm a GP. I have a special interest in women's health. I guess I've always, even through medical school and through all my hospital jobs, been drawn to looking after mums, babies, anything pregnancy related. It's what I love and what I'm passionate about. Thrive Perinatal. So Thrive Perinatal is really me fulfilling my vision and dream to be able to provide better, more comprehensive care to mums and babies. Working as a GP, I so often would have mums come in, especially in those first 6 weeks after birth, and everything would just be falling apart. I mean, many women, things don't fall apart, but for many women, they do. And they'd come in for their 15-minute appointment, and I just couldn't even scratch the surface of trying to help them with all their issues. So it had been an idea bubbling away for several years that I just really want to go into these women's homes and do a home visit, spend an hour, hour and a half with them and try and help sort out everything, a bit of a one-stop shop. So this was something that I just had on the back burner for a while and being I've got 3 kids of my own and working, never really had time to think any more about this. And then COVID hit, and I, being a general practitioner working in the Melbourne CBD, suddenly it was a ghost town, and I had a little bit more time on my hands for a period of time to think about, well, maybe I can make this vision a reality. So I started looking into how I would go about that, because it's not really a service that's existed before, GP service specifically for mums and babies during this time. So I had to figure out whether it was viable, and then I went ahead and did it. So I guess it started off as a home visit service. Then with COVID, they've introduced telehealth, which suddenly made it a whole lot more accessible to be able to not just do home visits, but video telehealth, which is fantastic for new mums who are stuck at home with their babies. And now I've extended that into face-to-face appointments. So,
yeah, it's amazing. And I still distinctly remember my 6-week checkup with my first baby and being in and out, and they said, yeah, everything's going really well. That's great. We'll see you when you're next pregnant. And I remember a bit of a jaw-dropping moment, like my whole life is turned upside down. My body feels different. What do I do with this baby? And I remember going back onto the street and thinking, oh, my God, help.
Yeah.
Fantastic. So let's start at the start. Why do women need a 6-week checkup?
Right. Well, a 6-week checkup is, well, first of all, what is a 6-week checkup? It's essentially a routine medical review, usually done by a GP. Why do women need it? Well, it's a 6-week checkup for me is not just for women, but for their baby as well. So we're sort of talking about for mum and for baby. Why do they need it? I think it's really just a formal review, but not just a physical review of mum and baby, but an emotional review, touching base with mum, especially checking in on the mental health side of things and emotional side of things, but also a social sort of examination as well, making sure that, seeing how they're coping, how they're getting on, and providing that extra support.
Yeah. Okay. So it sounds like it's quite involved. Let's break it down. So when it comes to the baby at the 6-week check, what are some of the things you might examine with the baby or talk about?
Sure. All right. So, well, I might backtrack one step and say that when I do a 6-week check, I encourage mum to bring in their baby health book and also a list of any questions or concerns. So often mum or both parents, to be honest, it's lovely to have dad there as well, have them bring in a list of any issues, concerns that they might have about their baby. So I do like to find out, look through the birth history. I'll ask them to bring in their medical discharge summary from the hospital too, because that has a whole lot of information about mum and baby on it that can give me a bit of the background, whether there were any issues or concerns. So with the baby, if I start with that, I like to know a bit of the history first. So I like to know whether there are any issues during the pregnancy, whether there are any issues with baby during birth, in recovery. Did baby need any resuscitation? Did they need to go to special care nursery for a period of time? So that really gives me that background. And we often will have a chat about these things, going through mum's concerns. But the examination, I guess, is probably the last part that I would do after getting all the information. Yeah.
There's so much to cover, isn't it?
There is. I could go on forever.
Yeah, absolutely. Yeah. I know that in Australia there's the maternal child health nurse checkups, and they also look at a lot of baby stuff. Is there anything you would do in addition or separate to that?
I think a lot of what we do, and as healthcare workers we're trained for, are sort of similar, but I guess we do have that extra medical side of the examination. I mean, I would generally, apart from, well, maybe if I take you through what an examination involves when I do it. First of all, just generally looking at the baby, seeing if there's anything that looks unusual or different, looking at their skin, seeing if they're jaundiced. They could be bright yellow. We check their eyes. We screen for congenital cataracts. I will always check a baby's mouth, look for oral thrush, check their palate, look if there's any obvious tongue tie, things like that. And basically it's top to toe, work my way down. So next I'd move on to listening to their heart and lungs, making sure there's no signs of any sort of cardiac problems, feel their tummy. Checking the hips is a big one, and parents will see that as health professionals we're always checking their baby's hips because we're screening for a hip dysplasia condition, which is really important and very important not to miss. checking the baby's skin for any rashes. Newborn rashes, especially in those first 6 weeks, are incredibly common. Most of them are benign and nothing to worry about, but every now and then there can be ones that we do need to be looking into further. And then there's a neurological examination. So apart from just the physical side of things, we're looking to see, is this baby developing normal? Are they meeting their milestones? Are they moving all limbs equally? Could there be any signs that there's anything else going on? We check babies' reflexes as well. And, it's really is a comprehensive sort of examination top to toe.
Yeah, brilliant. So that could take the whole session in itself, couldn't it?
Oh,
without even getting to the mum side of things.
And that's why another reason I've chosen to do what I'm doing with Thrive Perinatal, because you can't do this in a 15-minute appointment.
Yeah, absolutely.
My 6-week checks, I would always, if I had the opportunity and I was caring for the women during pregnancy as well, I would say, please book an hour. 30 minutes mum, 30 minutes baby. If we don't use the time, that's fine, but at least we've got the time if we need it.
Yeah, and I just love that. I think that's why I wanted to get you on the podcast today, because I just think this is so special. And for mums to know that this sort of service does exist and they just don't need to be in and out within a 10, 15-minute appointment is really important. Okay, so let's move. Is there anything else you wanted to talk about, baby?
I guess, if I get time, I do like to be able to cover. I'll talk a little bit about what to look out for if you're worried about baby, because suddenly, mum and dad become mum and dads and they've got this baby to care for and they don't know what's normal, what isn't normal, when to go to the GP, when to go to the emergency department, what's important and what isn't. So if we get time, then I like to cover that. And also vaccine counselling. There's a lot of discussing the routine vaccinations that are available, but there are also additional vaccines, and I do like to cover that as well. And so make sure that parents are informed that there are extra additional vaccines that they can get, which they pay for privately, but can help protect bub.
Okay. Could you run through a few of those?
Okay.
Just to put you on the spot.
Put me on the spot, yep. So I guess the extra additional ones, you might have heard of meningococcal vaccines. There's several different strains of meningococcal virus, which is a bacterial infection that's extremely rare but really quite dangerous and potentially lethal to infants. There are vaccines that can help protect against that. In particular, there's 2 different ones. So there's one called the B strain and there's a vaccine called Bexsero, and there's another one which is given when the baby's 12 months old, but this can be given as early as 6 weeks, and it's like a 4-in-1. So it's ACWY strain, and that goes by different brand names, Pneumorex and Menveo. So there's the 2 different meningococcal vaccines that can be given. And
I'm sure a question on every mum's mind is, are there any potential negative effects with that vaccine?
Oh, vaccination, so topical at the moment, isn't it?
Sorry, we weren't going to get onto vaccinations, but here we are.
It's going to be hours and hours of discussion about vaccines.
Or any links that you could recommend mums if they want to learn more about this? Perhaps have you got any links that we could link in the show notes?
MVEC, MVEC, if you type that into Google, has really good information. It's a government website that can give you pros and cons. I mean, essentially, if I break it down in a nutshell, I'm very pro-vaccination. If there's anything I could possibly do to protect my children against any potentially deadly diseases, I would do it. My 3 children are all fully vaxxed. As I tell my patients, they're vaxxed up to their eyeballs, and I've got that feel comfortable knowing that that I've done everything I can to protect them.
Yeah. Okay.
But in summary, the vaccines, any side effects are extremely rare. The Bexsero vaccine, which is the meningococcal B vaccine, does have a higher rate of babies a bit more irritable or potentially having a fever. So it's recommended that they get a dose of baby paracetamol 30 minutes before the vaccine. That's the only vaccine we do that for. But on the whole, if you can protect your child against meningococcal disease, I think it's well worth it.
Yeah, absolutely. And I remember, do you have to go back for a few boosters of that?
Yes, correct.
Yeah, because I actually found that one really, and I found that personally hard to keep track of, because especially when it got to my 3rd child, because it's not part of the normal vaccination record, so to speak, And I had to personally sort of follow up on that with my GP. And I think by the time it got to my third, I'm sure she got it in the end. But I remember that being a struggle to stay on top of what I needed or what the options were. This episode is brought to you by Baby Bee, Australian-owned and designed prams combining quality, safety and style. Not only does Baby Bee let you try their prams at home with free returns for 9 months, yes, that's 9 months, they also offer an industry-leading 3-year warranty for total peace of mind. With thousands of 5-star reviews, around-the-clock customer care, and up to $300 of free accessories with every pram, what are you waiting for? Go visit www.babybeeonline.com and check them out for yourself. And yes, for listeners of the podcast, there is a 20% discount code. Enter FITBEE, FITBEE 20 at checkout, and T's and C's apply.
Yeah. So the younger the child, the more vaccines they need. Because their immune system is immature, they need boosters. That's why their routine vaccines are given at 2 months, 4 months, 6 months and 12 months. So they need these boosters, and the same goes for the meningococcal vaccines as well. With the timing, I often, at the 6-week check, if the parents are keen to get these meningococcal vaccines, they can fit in quite nicely with the same intervals as your other vaccines. Or even some parents want to have a little think about it, in which case I say, well, you could get them done at the 4-month vaccines and the booster at the 6-month vaccines, and then the final one at 12 months. So the 4, 6, 12 months fits in quite nicely with these meningococcal vaccines.
Okay, that's great. So what we'll do, can you just say that website one more time?
MVEC, MVEC.
And I'll link that in the show notes, ladies. So just have a look in the podcast and you should see it. Thank you. So that's great. So you can check that out whether or not go for it.
Yeah, I was going to say there are other additional optional extras as well, but usually when they're a little bit older. But they include, I'll just list them so that we've been complete here. Influenza vaccine can be given after 6 months. A chickenpox booster vaccine can be given after the child is 18 months. And I really love parents to know this, because it is recommended that chickenpox vaccine is given with a booster shot, but the government here in Victoria only fund 1 vaccine, not 2. So after from a month after they've had their chickenpox vaccine, when they're 18 months old, you can get them their booster, and it brings their immunity up from about 85 to about 97%.
Okay, amazing. Thank you for running through, because I know vaccinations can be a bit complicated, a bit daunting. It's a lot of information suddenly. So thank you for giving us that information, those resources. That's great.
That's okay. And it's a lot of vaccines to give to one child at one time, and a lot of parents struggle with that. But it is perfectly safe to be given all at once, and I think it's just that knowledge that they're protected, I think, is really important.
Okay. On that note, with COVID vaccination, how early can you give that to babies?
That is currently not licensed in babies. It is licensed for over 5-year-olds. So,
of course. I know that. My 4-year-old's not vaccinated.
Not there yet. Yeah. And I don't think it's going to be anytime soon. They really don't think it's particularly effective in that young age group. And though, again, it's weighing up risks and benefits. So children and babies and infants really, they're doing pretty well if they get COVID. It's very rare that they're going to get really sick. So
okay. Moving on. So we've talked quite a lot about baby, about vaccinations. One question I did have, you talked about checking the hips, and I know that's something that gets checked a lot with maternal child health nurses.
Yes. Is
hip dysplasia something that can be checked a lot when they're young, and then it sort of becomes more apparent as the baby grows? Is that why we have so many checks for the hip dysplasia, or is it just really important we don't miss it?
I think it's really important we don't miss it. A hip dysplasia is essentially where a hip joint, which is a ball and socket joint, the socket is quite shallow and the hip can move around. And in worst case, some babies' hips are actually dislocated at birth. It's something that we can treat 100% successfully. And parents may have seen babies in a little hip brace where their legs are sort of out in froggy position, called a spiker or a Pavlik harness. And being able to detect any issues with this formation of the hip at a young age is crucial, because if anything is found, if this hip socket is found to be shallow or there's any concerns at all, we can, by referring on and having a harness popped on, they can avoid getting hip arthritis in their 20s, or, for ones that have been missing in times gone past, adults might be needing hip replacements in their 20s, and that's just such an important thing.
Yeah.
So we always check hips. We look at creases. I get many referrals from maternal child health nurses sending in babies to me because they've noticed that the creases on their thighs, those cute little creases in their chunky little thighs, are uneven, and sometimes that can suggest there's an issue. Not always, of course, but if there's ever any doubt, I refer on for an ultrasound. And an ultrasound, there's no radiation involved. It's completely safe. And I always err on the side of caution with hips.
Yeah. And you need to have a GP referral for an ultrasound. Is that correct?
Correct. That's correct. Yes. Yeah.
Yeah. Thanks for clarifying that. And if anyone listening is interested in learning more about hip dysplasia, we have had a relatively recent episode with a paediatric physiotherapist who talks about it a bit as well. And there's even some information. We've got an episode on baby slings, baby wearing, and she talks about the different slings that are recommended to help support the hips. Is there anything and so I'll link that in the show notes too. Have you got anything to say about slings and those harnesses?
I think the important thing is with bubs is that they need to be able to get their little legs into froggy position.
Yeah.
And there's swaddling your baby, it's important to know that if you swaddle them tightly, their hips still need to be able to move around, because if they're lying in a straight position with legs straight out, it's not the position that favours this improving the hip joint formation.
I always used to joke with my husband, because I was always a shocking swaddler. You know how some mums really have the knack and their baby's beautifully swaddled up? I always used to joke, because within 10 minutes my baby was loose. But I always said that's great for their hips.
Exactly. I was a Velcro swaddler mum. I gave up on the muslin cloths and into the little Velcro things at the time. So, with their legs free. So, but that was my children were born in Singapore, so that was, you sort of use what's available, depending on where you are at the time.
I haven't heard of Velcro swaddles. Are they still around?
No, it was really just a little cloth swaddle, but you'd sort of stick it around the front over the arms when there's a little bit of Velcro. So I don't think that's my term for it.
Yeah. Okay. Let's move on to mum. Can we move on to mum?
Right, absolutely. Let's move on to mum. So mum, I always like to find out how they're going and debriefing a bit about their birth. Some women sail through. Other women don't sail through, and people, I think, can underestimate the trauma that women can experience. It doesn't matter what happened, there can be struggles with that. I remember just one of my patients comes to mind who her labour was so quick. She delivered within an hour and a half her first child, and it was just completely different to what she'd anticipated and what she'd thought it was going to be. And just something like that can really throw you and can become a struggle. And so I think debriefing, I do like to spend some time and finding out how it went and their feelings about how it all went.
That's so great to hear, because I think that's something that can't be underestimated, the power of debriefing, especially with a medical professional. It's that much different, I think, to debriefing with a family or friend, which is still important. But we had this exact conversation with Helen Nightingale talking about birth trauma and debriefing. So I'll link that in the show notes too.
Yeah, good. Please do.
Lots of episodes to link.
So important. I guess I'll then move on to what if they have any concerns, and often they will. Often there'll be a long list again, which is why I like long appointments. But the sorts of things that women experience after birth, that issues with pain, recovery from cesarean section or their perineal pain from vaginal birth, bladder function, and that comes certainly like to ask about whether they're having any leakage, incontinence, any issues, and that's where people like yourself come in. I will always ask whether they've seen a pelvic floor physiotherapist, because I think it's a really important and good idea to get that expertise. Baby feeding, I really like to take a good history to see how things are going, whether they've chosen to bottle feed, breastfeed. So many women think that they're going to be able to breastfeed, or certainly hope to breastfeed, and things just don't turn out the way they had hoped. So I like to spend I invariably spend a lot of time talking about feeding, and I have a special interest in breastfeeding medicine, so I do like to help them with those issues as well. Contraception.
Going back to the breastfeeding,
yes.
Can you help with things such as, do you talk more about like the attachment or timing? Do you look for tongue tie? Like what sort of things do you help?
All of the above. Yeah. So I've done upskilling in breastfeeding medicine. So a lot of my consults are just mum and baby breastfeeding consultations. But I guess because I've got that medical background, if they've got mastitis, then I can give them their antibiotics for their mastitis. It's really a bit of a one-stop shop where I can try to deal with everything. Yeah.
Amazing.
Contraception.
Yeah.
Often we have a bit of a laugh about it because at 6 weeks there's a lot of women who don't need the contraception at that stage just yet, and for the foreseeable future. There are other women who jump back into being sexually active, and it's really important to know that breastfeeding, it's a very good form of contraception, but it's not 100%. So I like to discuss options that are available for that.
Could you run through the top 3, I guess, most popular forms of contraception after having a baby?
Yep, sure. Well, the easiest one that many women choose is just to use condoms with a lot of lube. And a lot of women aren't ready to start taking anything hormonal at that point. That's a personal choice. So that would be, one of the 3. The Mirena is a fantastic form of contraception to space between babies. The Mirena is an intrauterine device, or used to be known as a coil. It's a device that is popped in. I don't do them, but there are other practitioners who do, or your gynecologist can pop them in, or Family Planning Victoria are the other people to approach to have a Mirena put in. And it's a fit and forget type of contraception. So if we compare that to the 3rd option I was going to mention, which is the mini pill, or even the standard pill, there used to be the advice that you can't be on the normal contraceptive combined pill after birth because it interferes with milk supply. These guidelines have changed depending on the individual as to whether I'll prescribe it or not, because I still like to be a little bit conservative with that. But going back on the pill is certainly an option. Problem is, when you have a new baby, trying to remember to take a pill at a certain time every day becomes really hard. Yeah. And it's the last thing on the agenda, really, for a sleep-deprived mum. So I think if people ask what would I recommend, and if the Mirena is certainly at the top of the list. And
out of interest, why would you, because I know there's the copper IUD. When would you use the Mirena over the copper IUD, and what's the difference?
I would use the Mirena almost every time over a copper IUD. Mirena has a very low dose of progesterone hormone on it. So what that does is that it actually thins the lining of the womb so that it reduces menstrual bleeding. Now, when women are breastfeeding, they're often not bleeding anyway, so it's a really good time to start that. Copper IUDs have their role in women who don't want the hormones on the device, but in saying that, progesterone is at such a lower level, lower than when you take the oral pill as well, that it really has very little hormonal effect. Copper IUDs the main side effects are increased period pain and also heavier bleeding. So it's just not as commonly used anymore. In fact, it's really quite rarely used.
Interesting. Okay. Now, I want to backtrack as well, because you mentioned condoms with lots of lubricant. Yes. Yeah. And I just want to add my little 2 pennies worth too, because sometimes sex can be uncomfortable after having a baby. And when you're breastfeeding, as we know, your body's very low estrogen, and that can cause vaginal dryness. So big tip for anyone who's thinking they're ready to get back into having sex, lubricant. Lots of lubricant. Because of that, vaginal dryness, just to help help comfort levels, really.
That's right. And there's lots of different types of lubricant that you can experiment with as well that can make a difference. And then if there's still problems, I do like women to know that the vaginal estrogen is an option as well, if your GP is happy to prescribe that. And I do think it's underprescribed. It's very low absorption into the body. It's a lot lower dose than you even taking the contraceptive pill, but it can make a massive difference down below to comfort and having any urinary symptoms or pelvic floor issues. But that's where pelvic floor physiotherapists like yourself come in, because you guys are really good at having a good look down there, much more. I mean, you do that all day. So, I like to refer on to a good pelvic floor physio.
Yeah, and we're often referring back to the GP for them to discuss with their
For the
GP.
estrogen.
Yeah, for the estrogen, because if there's pelvic like prolapse, there's been some great research to show topical estrogen can really help to improve those symptoms. So lots of reasons why topical estrogen might be effective. So that's music to my ears to hear. That's great.
And especially for breastfeeding mums, because breastfeeding really does drop these levels of estrogen. They plummet, and women can get all sorts of funny little symptoms, but that's certainly one of the most common is vaginal dryness.
Yeah, and if we think about the 2 times in our life when we're more likely to have pelvic floor issues, there's a spike around having a baby, and then there's a spike around pre-post menopause. And both those times, if we think our body is lacking estrogen, and correct me at any stage, Miranda, but the vaginal dryness, that also, if we can think about a nice plump tissue, like a nice, what's another word for it, but low estrogen can thin out tissues and make them less plump, and that's when symptoms of leaking and prolapse and painful sex and that sort of thing might become more prevalent. So that's where the topical estrogen is really local to that area, as Miranda said. So, it can be fantastic.
And I think it's interesting when I will examine a woman or do a pelvic examination before estrogen and then even 2 weeks after estrogen, the whole appearance down below looks, as you say, plump, healthy, moist, lubricated, and you just know women are going to be a lot more comfortable.
Yeah, fantastic. Okay, good to know. Where were we? So we've talked about mum, we've talked about the mental health side of things, debriefing, we've talked about contraception, breastfeeding.
That's right. Examinations, sometimes I will examine women or have a look at their perineum. It's not every time, though. It really does depend on the individual. Some mums have breezed through, have no issues, no concerns, but there's a lot of women who might have had a tear or an episiotomy, or they just want to know that everything's healing nicely, and I might check their sutures and have a look down below. Or another common thing is women might have an unusual discharge or a little bit of bleeding that's going on for a little bit longer than expected, in which case I might do a pelvic examination, take a swab. Sometimes I'll do a cervical screening test as well. It used to be known as pap smear if they're due, but not for everybody.
Yeah, okay, good to know. Do you find any common themes of topics that mums want to discuss at the 6-week mark? Like, what would be the biggest couple of things that are really prevalent to a new mum? Would it be the birth, the debriefing from the birth? Would it be difficulties breastfeeding? Like, what would you say are the biggest challenges that mum might be facing in this time? And I know it's probably a really hard question to answer.
Yeah, look, I guess the most common one would probably be feeding issues and breastfeeding issues, and not feeling that they're having problems actually with their latch, with their feeding, with their nipples, with nipple damage. But then there can be knock-on effects from that too, such as things like blocked ducts, mastitis. So I do see a lot of that. And then there'll be those women who have an amazing journey with their breastfeeding, no issues whatsoever, but they aren't coping emotionally, I suppose, because suddenly it's just been them and their partner, and then overnight they've become a parent, they've got this new baby, their relationships change with their partner, they're sleep deprived, they're emotional, they've got the hormones raging, and often lack of support. And at 6 weeks, it's probably the time when a lot of the dads go back to work. So I have a lot of women who have that fear and trepidation that what's going to happen now, because suddenly it's just going to be me at home. So I do a lot of perinatal mental health, I guess, trying to help women manage this, sort of normalise it a bit for them, but also give them that support referral if needed too.
And when you say referral to what sort of services?
Well, it depends on what's going on. I mean, a lot of the time women can feel a whole lot better after just knowing that what they're feeling is normal. And when I say normal, I'm not minimising it at all. I'm really just them knowing that it's okay to have these feelings of fear, guilt, sadness, all of the things that go with it. So sometimes they won't need any referral at all. There's a lot of online mental health resources as well, and so I'll often point them in the direction of that. And you ask about online resources, the Head to Health website is a government website that can show you all the resources that are out there. So that's a good starting point.
Okay.
Or you can have a look at my Thrive Perinatal Insta feed, and I've got a link there on one of my tiles with a few of the main ones there too.
Yeah. Fantastic.
And then referral to psychologist, obviously, or other specialised mental health therapist, psychiatrist, whatever's required, really.
Yeah. Okay, so that's great to know. There's a lot of support available. So a really good first port of call is your GP to talk through those issues and concerns. So to wrap this up, if there's a pregnant mum listening today, any final words of wisdom to her, or any bits of advice you'd part with?
Well, I guess because the topic of today is 6-week check, then I think it's a really good idea to book a 6-week check. A lot of people have never heard of this concept, or it's usually mentioned at the hospital on discharge, go see your doctor at 6 weeks, but a lot of women forget this in the moment. So I do think it's nice to formalise it and book an appointment for you and for your baby. Now, women who have a baby in the private system often have their 6-week check with their private obstetrician, but it's important still, I feel, to have baby checked. If they have had a paediatrician, do a 6-week check, fine. Otherwise, book a time with your GP and maybe ask if you can book a little bit longer appointment too. And finding a GP who's got an interest and experience in mums and babies, I think is really important, because you might have a bit of a different experience.
Great advice. Thank you.
Oh, can I add something there?
Yeah.
Don't wait for 6 weeks if you've got any concerns. The 6-week mark is not, it's not suddenly like, yes, we're going to detect everything at 6 weeks. It's really just picked out as a suggested time that's good to touch base with your doctor. I like women to have a 2 to 3 week check, honestly. We can do a lot of this at a 2 to 3 week check, because the earlier we get onto these things, the better. Trying to nip things in the bud's really important, physical and mental health. So if you've got any concerns, don't wait for a 6-week check. Get seen earlier.
Fantastic. And on the flip side, if you feel you've suddenly realised you're 8 weeks and time has passed, it's not too late either. So
absolutely, and it's an opportunity. I didn't mention in the baby check, I do like to measure baby, weigh baby, check their growth patterns as well, and just make sure that everything's tracking nicely, whether it's 6 weeks, 8 weeks. If you're tying the 6-week check in with vaccinations, it needs to be at least 6 weeks, because the vaccines must be given from 6 weeks onwards. But it depends on where you're going and who you're seeing for your check, as to whether you're doing that on the same day, or you can have an appointment first and vaccines on another date.
And I just want to chime in there as a mum, thinking, okay, there's nothing wrong with my baby, but then just going and having a professional opinion, someone to say everything's going really well, your baby's developing really well. Even if you thought that, I personally always find that a big relief and almost like a confidence builder. It's like, doing well. So just that verification, I think there's a lot of power to that. So
absolutely. And I think often new mums, it's a hard slog, and no one's really telling them that they're doing a good job. And I like to tell mums they're doing a good job. Yeah. So
beautiful. Well, on that note, where can mums listening find you, Miranda?
All right. Well, I practice in Melbourne. I am now offering face-to-face appointments in Armidale on High Street, but I also do video telehealth appointments as well. So people can be, it's a lot more flexible for people to get that advice. I mean, nothing beats being face-to-face, but telehealth is still a really great tool. My website is www.thriveperinatal.com. And I have an Instagram feed at Thrive Perinatal. I also have my at Dr Miranda Bradley Insta, which is more of a personal one, because I'm with a few interesting photographs, because that's one of my hobbies. But you can check out both if you like. And fantastic. I'm most happy to answer any queries by email. My Thrive Perinatal business is really just me. I'm doing my own admin at this point in time. So if you send me an email, it will be me replying to you. So, and I'm quite happy to answer any queries.
Oh, beautiful. Well, I'll put all those links in the show notes. Thank you so much for your time today. I really do appreciate it. It was really informative and hopefully reassuring for mums who are heading into this 6-week check. So thank you.
Thanks for having me. It's really nice to chat.
Beautiful. Thanks. We'll catch you soon. And before I sign off, remember my team and I will be putting together the show notes for this episode with all the links that Dr. Miranda Bradley talked about at www.fitnessmama.com/podcast. And don't forget, if you want to come and join us inside the postnatal workshop, head to fitnessmama.com for all the details. That's it, ladies. Have a fabulous day, and I look forward to you joining me next week for another episode of the Fitness Mama podcast. Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer, materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis or treatment. I'll see you soon.